Do you have questions about the effect of testosterone on PSA or your prostate-specific antigen? Do you want to know whether or not testosterone therapy is going to make your PSA go up? And if so, why is that happening? Should you be worried, etc.? My name is Dr. Taranella. In this video, we're going to answer that specific question: does testosterone affect your PSA? We're going to address why this happens and what to expect when you're on testosterone replacement therapy and your PSA. So if you like this kind of information on hormones, health, nutrition, and just really trying to get a better, deeper understanding of what's going on in your body, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Okay.
Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment.
Let's look at this question. Does testosterone affect your PSA levels? So this video is going to answer the question, does testosterone affect PSA? And this comes from a specific question I got from a viewer. They were asking, do high levels of testosterone from testosterone cypionate affect your PSA levels? So the answer to this question is yes, testosterone almost always raises PSA given enough time. Testosterone increases the body's production of two important hormones that have an effect on prostate tissue, and those are estradiol and dihydrotestosterone, also known as DHT. Both of these hormones can cause the prostate cells individual cells to grow and then divide and turn into new prostate cells. Since PSA is a protein, PSA stands for prostate-specific antigen, and the antigen is a protein. Since it is a protein and the amount of that protein is a reflection of the amount of prostate tissue available or present, it only makes sense that more prostate tissue means higher PSA. We also know that with age, the PSA and prostate size generally does increase, and in part that's thought to be a reflection of the prostate tissue's exposure to these hormones, testosterone, DHT, estradiol. While there are some small studies showing that PSA does not rise upon administering testosterone, there are plenty of studies that are more well designed that do show PSA going up upon initiating testosterone therapy. You do have to give it enough time because it's not going to happen after one shot or 1 month of application. In some cases it can, but it's over time those hormones have an effect on the prostate tissue. Also, if you're applying testosterone topically and it's not actually getting into your body absorbing, which is a common problem with topical, then you may not have any effect because it's not actually changing those hormone levels. In my practice, I commonly do see increased PSA levels when people start testosterone replacement therapy. There's usually an initial spike after a few months of being on it, and then it kind of stabilizes, and then you sort of fall into the normal trajectory for age. It might rise over a couple, 2-3 years again after that. So it's typically going to stabilize after the initial rise in PSA when you start the testosterone replacement therapy. Then, there's a whole question about, does PSA even matter? What is the value of doing the test? That's not really what this video is about, but if you do have questions about things like that or other questions about testosterone and PSA rising, drop it in the comment section. I may do a separate video on that. Definitely try and answer your question. All right, that should give you a better understanding of this question, does testosterone affect your PSA? If you do have specific questions about this video or any of the content in this video, the relationship between testosterone and PSA, drop it in the comment section. I'll be happy to try to answer your question. I may do a separate video on that topic. Thanks again for watching. We'll see you next time.